Evening to everybody. I would like to know if you can hear me well, so if participants can tell me that everything is fine. Otherwise, I will start. First of all, I would like to thank you, my IVF answer and the EFS, to letting me participate to this event. There are two platforms very, very important in order to raise awareness to our patients and to educate them and help them and support them if they have any problem with fertility and if they are struggling with this issue. So this is so important. First of all, I would like just to spend a few words about myself. Okay, my name is Chiara. I'm Italian and I started working in fertility since 2004. My main task is to be with patients, coordinating their treatment and staying with the doctor until all their fertility journey. So this is so important for me. Actually, at the moment, I work in Reproclinic, Barcelona, and I'm the head of patient assistant and coordination team. And so I'm here today to present you one of the most requested treatment in our clinic, which is egg donation in Spain. So I'm going to structure this speech with a brief description of the egg donation in general that normally can last between 15 and 20 minutes. And then I will dedicate time in order to answer the question that you normally ask. I would like to tell you that the event is completely anonymous, so don't worry, it's a safe place for you, and that is recorded and everything will be online also through the YouTube channel. So if everything is fine, I'm going to start with the presentation. Okay, let's see. Okay, so egg donation in Spain, everything you need to know. The first important thing is that we need to focus about the legal aspect, meaning that when a patient chooses to do a treatment abroad, it's really important that he needs to be informed about the legal aspect in that country. So nowadays, now I have to talk about legal aspect in Spain because it's the country where we do the egg donation, it's the country of our clinic. So two main words are altruism and no compensation. Egg donation must be voluntary and unpaid. It's one of the fundamental principles of Spanish law, which is the prohibition of trade involving human body and their cells. Nevertheless, some clinics give like a compensation to the donor, which is completely legal because donor needs to face a lot of things and a lot of steps. And people that did IVF, they know what I'm talking about. It's very hard. So it should exist our formal agreement. This is so important. The donation process is based on a formal agreement between the donor and the authorized center. And one of the most important things is that you need to know that the medical team is responsible for selecting the donor, so no one else. So when a patient chooses the clinic, of course, needs to trust the center. And this trust is transmitted by our professional physician, but also embryologists and all the people involved. Anonymity and confidentiality are also two main aspects, which is so important because we need to protect the donor life, but we also need to protect the patient life. So we cannot know any important information. Just there is a limited information access to some basic things like age and blood group. Nevertheless, if there is some vital requirements, of course, the clinic can share more information, but just if it's a matter of emergency. The breaking this important rule can represent a serious offense to the law of Spanish assisted reproduction. So it's really, really important to know that everything is protected under privacy and under these two principles. It's one of the most important things, and when patients sign the consent form, they know everything, and normally a good professional must explain this to the patient during the first consultation and also during their fertility journey if they have any doubt about. Requirements for egg donors in Spain. It's very important to understand that it's not that easy to be an egg donor, okay? There are specific criteria, so donors must meet specific criteria. First of all, the age. The donor must be between 18 and maximum 35 years old. They need to be in good health. They need to have physical good health, but also mentally good health, okay? So what is important is that they need to pass several exams, medical exams, gynecological exams, but also psychological interviews and psychological tests in order to be sure that everything is okay and they are really aware of what they are going to do. The donor family history is also taken into account, which is so important because donors must have a personal and family history, normal family history, free of genetic disorders or serious illnesses. And as I told you before, Spanish law is under the anonymity and the confidentiality. And this is one of the most important things. At the moment, this law is not changing, so this is a guarantee for us, okay? So what is the process for IVF with an egg donor like? IVF is one thing, egg donation is another thing. So in egg donation, there are two main characters that we need to take into account. The donor, that plays a very important role, and the patient, the couple, the women that undergo to this treatment. The donor preparation is the one for an IVF. I mean, donors must do all these tests. They need to do the psychological interviews, and once they are accepted into the program, they start doing the ovarian stimulation. The ovarian stimulation is normally started with the second day of the period, where the donor needs to take every day drugs in order to help their ovaries to work more and to produce more follicles. And periodically, they come to the clinic in order to do several scans, okay? Normally, the average of 3 scans and also hormone tests in order to see if everything is fine and in order to see if this growth of follicle is properly. Once that the follicles reach a dimension that for us is correct, they have the egg release. So they need to take the last medication in order to trigger the ovulation, and 36 hours after, they have the egg retrieval into the surgery theater. The egg retrieval is not that complicated, and normally it lasts between 20-25 minutes, depending on how much follicles we have. Everything is doing under sedation, so it's a light anesthetic procedure. Of course, they need to sign a consent form also for the anesthesia, for the sedation, and they need to answer some questions for the anesthetist, sorry. And the intervention lasts about 20 minutes, and it's about inserting a needle connected to a vaginal ultrasound containing, to aspirate all the follicles, and then, of course, the follicles are retrieved, and then the biologist will clean everything and stay with the mature eggs. On the other side, patient needs to do a lot of things as well. They need to prepare, the first important things, they need to prepare their endometrium to achieve a proper thickness in order to receive the embryo. How do we do that? Normally, we gave estrogens and progesterone. Estrogens are taken orally, and they start to be taken with the first day of the period. And after 10-12 days, we normally ask to do a vaginal scan, and we measure the thickness of the womb line. So this can be done, of course, in our clinic, but otherwise we can check this control if the patient is in their own country and they send us the results, and of course we submit the result to the doctor. So as soon as we know that the endometrium is prepared, normally we need to wait the egg retrieval for the donor or the moment of the embryo creation, and we ask the patient to add progesterone pessary that helps the endometrium to stay soft and to receive the embryo, so that once the embryo is into the womb, he will stay. Okay. So this is for the endometrial preparation, but then of course there is also one important moment, which is collecting the sperm sample and the in vitro procedure into the lab. So we normally ask to patient or to come and leave a fresh sample if it's the case, or otherwise previously the patient come to the clinic and leave the sperm sample, and this sperm sample is frozen. So once we defroze the sperm, we can do ICSI. Sometimes we can do also natural IVF, but we normally do ICSI. ICSI consists in choosing the most important, the most beautiful sperm, and we introduce the sperm into the egg. The day after, we have the results of fertilization, so we normally communicate to our patient all these results, and we leave the embryos in culture until day 5, meaning that they reach the stage of blastocyst, which is the most complex and strong stage for the embryo in the embryo development. And at this moment, we do the selection. The embryologist selected the embryo, the most beautiful embryo that they have, and we introduce through the transfer the embryo into the uterus. The transfer is also due into the surgical area, but with no sedation, and it's a very important and beautiful moment because patient can see their transfer through the scan. So they exactly know what is going to happen. They can see their uterus, they can see their endometrium. Our doctor normally show to the patient where is the endometrium, and they normally see a little small explosion. Normally it's a white spot, and this is the liquid inside. There is the embryo. We normally check if the catheter is empty, and once we do this double check and everything is fine, the transfer is done. Then, of course, there is the waiting time for the pregnancy test, which is a waiting list, very, very very expected by patients. Okay, so now I need to speak about our clinic and why choose our IVF program with donor eggs. There are several clinics in Spain. There are a lot of information. I think that the most important thing for our patient to trust the clinic is to base the choice of the clinic in different points. First of all, have a good physician is key. I mean, a doctor that can do a first good consultation, a doctor that can decide your protocol, they can explain to you exactly what you're going to do. It's very important. But it's also very important to have a good laboratory with good embryologists. We have our own lab. We have 4 incredible and amazing embryologists. They take care of our material, your embryos, your sperm, your eggs, donor eggs, and the lab is very cutting edge, so this is important. You have to know that donors are in processes of doing a lot of exams, and we also offer the patient to do the genetical matching with the donor. This is a test which is not mandatory, but it's highly recommended, and we normally explain this during the first consultation. Is a blood test that normally the husband or the partner of the woman can do in order to see if he is an healthy carrier of some recessive illnesses. Normally we do this test to all our donor. So if the husband or the partner of this woman who is doing the egg donation wants to do the same exams, we can see if he is an healthy carrier of some mutation, and we can choose a donor who look like the patient and who is free from the same mutation. So when we cross the gametes, we diminish the possibility of the illness transmission for the baby that we will born. And this for us is important. We always explain this. I tell you it's not mandatory, but it exists. And I think that it's important to explain to our patient what is this test and if they can do it. So these for me are the most important points of our program. We offer different protocol, different quotation, different program that can guarantee blastocysts, because we want to do a transfer at the blastocyst stage at day 5, and normally we can guarantee from 1 until 5 blastocysts. This is discussed during the first consultation and is according to the personal situation of a patient. If a patient wants to have more than 1 children, if the patients just want to have 1 children, this needs to be discussed, and the doctor, a good doctor, needs to assess about this choice. Then, of course, we need to take in account that the decision is of the patient, and is always will be the decision of the patient, but then the doctor should assess according to their personal situation. So the number 1, 2, 3, and 5 mark the minimum number of embryos guaranteed, but on many occasions we only used to give more. Okay. And it's important also to understand that in order to accomplish the guarantee of the blastocyst, of course, we need to check and evaluate the male factor. So sperm is evaluated the day that the patient leaves the sperm sample. Our embryologist do a check and see if the sperm sample enter to some criteria and if he accomplished the criteria of the guarantee. What happens if it doesn't accomplish this criteria? No worry, we can give the minimum of eggs that we need in order to achieve 1, 2, 3, or 5 blastocysts. All this is explained during the first consultation. So this is also important. We have several programs of donation. In all program, okay, we normally comprehend various elements. This is a list, but the most important thing that you need to know is that when we stay with you during the first consultation, there is the doctor and there is 1 patient assistant. The doctor explained the procedure to the patient, and then the patient assistant always sent to the patient the personalized quotation, and he marks what is included and what is not included. And this is so important because people do not have then any hidden surprises. Okay, I think that this, to be clear and transparent, is one of the most important things when we explain and we are talking about treatment that are not really cheap. I mean, they have a cost. So the first medical consultation is included and is normally done into the language of the patient. So we have our physicians that speak several languages: Italian, German, English, and French, which are the most important language that patients use during the first consultation. We can do the first spermiogram analysis, of course, the egg donor selection, the egg donor matching if the patient required the CGT test, the genetical matching that I mentioned before, the egg donor treatment. Okay, once we have the egg donor that undergo to the treatment, that she comes to the clinic and she do all the scans here. Okay, also the evaluation of your scan, your pap smear test is included into the quotation, and we also guarantee every time a donor as a backup. Sometimes, and unfortunately, donors are not machine, they are women. So sometimes it can happen that the stimulation, we are not expecting some results and we need to change. So we always ensure, pre-select a donor, but we always have a donor, a backup donor, in order to guarantee that the procedure will be accomplished. I think that this is important because we are prepared. Then, of course, all the blood tests and the medical reports during the treatment. We are in constant communication between the patient and the doctor. We are the link between them. And, of course, the egg and sperm preparation for vitrification, for fertilization with fresh or vitrified egg. We do the ICSI method, and we use the prolonged embryo culture until day 5. The first transfer is always included into the quotation. It can be fresh or frozen, but the first transfer is always included. And of course, when you do the pregnancy test, you can choose, of course, to come to the clinic and do the pregnancy test, or otherwise to do these results abroad, send us the results, and then of course we schedule a phone call with our physician in order to tell you what to do. Okay, normally if the test is positive, and we are so happy to share with you this happiness of this moment, we tell you to carry on the treatment, and we give you the first scan in order to check that there is a pregnancy, a real pregnancy with heart activity. And if the test is not positive, of course, there is a phone call scheduled with our physician, and the physician gives you the instruction to stop the treatment, and we can talk about what to do in the next step. And this is a moment also that is so important, and it's important to be supported by a doctor. When we talk about success rates in donation, we normally used to talk about cumulative success rate, okay? Success rate depends on many factors, okay? First of all, we need to see if there is no pathology in the womb line or in the endometrium. Then, of course, we need to see the quality of the sperm. This is so important. So male factor is evaluated and is important. And then, of course, the quality of the embryo. Normally, embryo that are not of good quality are not transferred. And so that is why it's so important to select the best embryo. When we talk about cumulative rates, meaning that you have the first transfer and then the following transfer with frozen embryo transfer, we are talking about an 83% of probability. With the first transfer, we can have between 60%, 61% of probability of success rate. So this is normally what for me is important to explain. And I have some questions now that are the most frequently asked question in patients that come to our consultation or do the consultation online. And I would like to share with you, because I think that probably can help you in order to know. So how long does it take to find a donor? Normally, we have no really waiting list. It really depends about the fact that you're choosing to do the matching, the genetical matching or not. If you choose to do the genetical matching with the donor, these results is normally ready after 4 weeks. So you take in account that we can have like 2 months in order to start your preparation to have your transfer. Otherwise, it's 1 month, 1 month and a half. Sometimes when it's like a very particular phenotype, the waiting list is a little bit longer, okay? But it's always discussed with the physician during the first consultation. What is the duration of an egg donation treatment cycle? The preparation for the patient is not that long. Normally, it starts with the first day of period when the patient started to assume the estrogens that help the endometrium growth, and after 10 or 12 days, we do the first scan in order to check that the growth is correct. If it's not correct, what we can ask is do another scan few days after, or to increase a little bit the doses of the estrogen. It depends about the situation of the patient, and it is always decided by the doctor, okay? Once the endometrium is ready, then we just need to wait the moment that the donor is ready or the embryo creation, and then after 5 days from the embryo creation, we have the transfer. So more or less, it takes like 22 days of preparation. Most of patients have questions about donors. Who are these ladies? I mean, the lady will look like me. I understand that this is very complicated topic, and this can create a lot of concern. how can I say, the clinic needs to guarantee that the donor will be selected really through an accurate selection of the phenotype of the patient that received the embryos. This is so important. So we normally discuss this in a meeting, in a weekly meeting, with the responsible of the laboratory and our medical director. Every week they assign the donor to the patient, and the patient needs to be to know that she cannot participate in the selection of the donor. She cannot choose any specific traits, because it's the medical team that do this job, and they really take their time to do a very exhaustive meeting every week in order to do this. For us, it's very important because we want that our patients are pregnant, are happy, and of course, we think about the future life of this baby. So it's very, it's a key factor to do a good selection of the donor. And one of the most important questions as well is, what is the age limit for undergoing a treatment at our clinic? In egg donation, we put the limit of 50 years old, meaning that you have all the time of your 50 year in order to do this transfer and to finish with all this the frozen embryo that you have. But after 50 years old, it won't be possible, because we established this like the limit of the fertility age of patient. So this for us is our limit. So more or less, these are, I mean, the main topic of the egg donation here in Spain. And now I can just see if there are any questions that we can share. And I have one which is very good. It's if we have any Japanese or Korean egg donors. Good question. This is not that easy. It's true that it's not that easy. Sometimes it's hard to have any Asian donor 100%. So what we do in this in these circumstances is that the doctor speak with the patient at the first consultation, and we normally give one donor that probably has some Asian roots, but is not Asiatic, is not from Asia. And of course, it needs to be explained to the patient, because for culture there are Asiatic donors are not really frequent. Okay. Then I have another question. Okay, my question is, whether at your clinic and in general in Spain is a basic protocol to do karyotype genetic blood test before a treatment start for both party, for donor and for the husband male party. Also, I would like to know whether after recurrent miscarriage, the sperm genetic test should be checked, or do your clinic advise to check? Okay, karyotype are important. Karyotype is mandatory for donor, and karyotype in the partner, the male partner, is important as well. So we normally ask to do this test. And after recurrent miscarriage, using donor eggs, of course, the sperm genetic test should be checked. Yes, we normally have our doctors that can assess you, but it's also true that we also have a very good andrologist, and sometimes you organize a specific consultation with the andrologist, because the male factor is really important, and sometimes we do not really it is like a taboo about the male factor. So andrologists are also very important as physicians. So this lots of questions do I have. So the upper age limit when reach your 51st birthday, yes. We count all the 50 years old, and then when you are 51, we cannot do a treatment anymore. Do you do PGTA on blast, reveal the gender on the embryo? No. Unfortunately, in Spain, the fertility law, the reproduction law, forbid the gender selection. Just we can reveal gender selection if it's something really important, like there is a special disease, genetic disease, and this is discussed also with the doctor. And PGTA in donor is not really recommended because of the age. Remind that the donor start to have 18, minimum 18, maximum 35 years old. So it's not really recommended to do PGTA because normally it's an indication above 38 years old. But if a patient insists on doing the PGT, of course we can do the PGTA in donor eggs. If my partner already has a karyotype, can these results be used? Of course, karyotype does not change. Karyotype is like the blood group. I mean, once you have your karyotype, it will last forever. So it's very good if your partner has already a karyotype. Of course, it can be used. It can be used. No problem with this. No problem. Okay. Let's see if we have more questions. I hope that my English is fine, but I can see. Okay, if a sperm donor is also required, do you have your own sperm bank or can be selected by the patient based on what characteristic you choose? We respect the Spanish law. Spanish law tell that the donor, sperm donor or egg donor, must look like the patient who received the embryo. Okay, we work with external bank. Okay, but we work for so many years with external bank, sperm bank, and we normally ask the donor sperm to them, and everything is also under the same law of anonymity, of confidentiality, and respect all these criteria. So do you do PGTA if the patient insists, but yes, exactly. We do not have this information. We cannot reveal the gender or the sex of the embryo, but we can do, if the patient insists or there is something that it's important for the patient, we can do PGTA in the embryos. And then I will also would like to insist that these questions are really important. When you do a first consultation with our physician, it's a very important moment for patients because they can share all their concern, and of course the doctor can answer to you in a very deeply way what is allowed, what is not allowed, and what we recommend. We do online consultation. This was one of the other questions. Do you do online for the first consultation? Yes, we do online, and we do the consultation here in Barcelona. But as the first consultation, normally the patient lives abroad, we normally offer the first consultation free of charge online. We use Google Meet, we prepare everything. We ask you to send us some basic exams. So these are important in order to prepare a proper and a good and exhaustive anamnesis, so that the doctor already know a little bit your case and can, start the consultation asking you and confirming some question, and then explain to you according to your specific case the treatment that you want to know, that you need to do. And normally the first consultation is free of charge. Okay, there are very good questions here. They ask me if we prefer fresh or frozen transfer, if there is a minimum quality for blastocysts that we transfer, and if there is a relation between the preparation of uterus and preeclampsia. This is complicated. So, several questions. Fresh or frozen transfer? It depends. We have no major difference in results with a good fresh transfer or frozen transfer. Sometimes we prefer frozen transfer because we prefer our patient to be prepared and to be with no stress. You have to think, of course, you are abroad. Imagine you are abroad, you do a treatment in another country. Sometimes we prefer frozen in order to organize everything. And so we have the embryo, we have the preparation of the patient abroad, and the patient just came here with a frozen embryo, and there is no major stress for them. The minimum quality for blastocysts that we transfer, normally with good embryo quality is an A, is a B. We do not transfer any embryo in C nodes, but again, We also offer, which is so important, consultation with our embryologist that can be done in English, and our embryologist can explain to you how they classify the embryos and why they choose to transfer one embryo instead of other. So this is important because normally the embryologists are like not really main character, but they are really important in treatment. So it's good also to speak with them and to know a little bit their criteria of selection. So this is, I think that this can be a good point also to have a first consultation with our biologist or embryologist. Okay, let's see if we have any more question. Anyway, I would like also to tell you that normally we are always available. We have our website, we have our email, which is reproclinic@reproclinic.com, when we can answer to you, where we can program first consultation. We can assess you also by phone, so there is no problem. We are always open. We have multicultural patient assistant that speak several languages, and we are here for you. So this is important. Let's see if there are more. I can see that you are a lot of people. This is good. Okay, the relation between the preparation of the uterus and preeclampsia, this, I am so sorry, but I will leave this question to the doctor. I think that a good physician must assess you during the first consultation, because these specific pathologists are for an expert, and a good doctor can assess you about. Of course, the preparation of the uterus is really important to receive an embryo. So if there are preeclampsia problems or issue, the doctor can tell you exactly how you have to prepare yourself. So sometimes, preparation can also be varied and can also be tailored according to your specific situation. So the doctor will be the one who can define the protocol, the medical protocol that you will need. Okay, yeah, sometimes extra tests are required. For example, mammogram is required after 45 years old. Cervical smear is something that we normally ask to all our patients, and normally has a validity of 3 years, so there is not something that it's like expiring so fast. And any other health check, of course, thyroid is important, serologies are important, the karyotype is important as well in the partner. But we normally, after the first consultation, the doctor prepare the list of tests that you normally have to do in order to complete your medical file. So we normally send to you this list in your own language, so you have it and you can do this exam or in your country, or for example with a second consultation, if you want to come and know the clinic and the doctor that did the first consultation online here, you can come in Spain and we can do all these tests for you. Let's see, I can see someone is typing a new question. Oh, thank you so much. I'm happy that it's helpful. I hope that everything is fine and that you can have your doubts solved. But it's true that with the first consultation, it's a lot of information. So normally it's a process. It's a process that people needs to understood. It's a process that people needs to share, and why that is why it's so important to have a good coordination team, a good patient and medical assistant, and a good doctor. And of course, remind that also our embryologists are very, very, very important, and they can solve you a lot of questions in terms of biological subjects. Let's see if there are more questions. One thing that I would like to also to tell you is that after the first consultation, of course, and the doctor will assess you, will tell you which kind of program, or will tell us that we are patient assistant, which kind of program is for you. And we normally send you the list of tests and also a personalized quotation. So normally the cost can vary. Of course, if we are talking about an RC1, so the guarantee of one blastocyst, it's more or less 5,000 euros, and it goes up until 9,000 euros if we are talking about 5 blastocysts. Okay, so different costs are for different programs, and you have your own quotation after the first consultation. And it's very important that a patient assistant can explain to you step by step the cost, what does it mean, what all the criteria, all the items are, and that you understand completely. So if you have any doubt, there are no stupid questions you have to ask, and we are here to help you always. This is the most important thing for us. Okay, I have a patient, Mary, that is 47 years old. I think you are on menopause. Can I help my situation with organs per donor? Of course, we can do double donation. We can use both sperm and donor eggs. There is no other. This is simple for us because it means that you have to come just the day of the transfer, so there is no problem. We coordinate your preparation abroad. I mean, you can start your preparation in your country, and the day that you have the transfer, you come to the clinic. We normally recommend to come one day before the transfer. You do the transfer, and or you stay one more night just in order to avoid stress. But in case you cannot, remind that you can take the plane the same day of the transfer. Nothing will happen. There is no major risk. How long will it take? What are the preparation? Well, the preparation, as I presented before, there are a preparation for your endometrium, for your uterus, that can be done through estrogens and progesterones. More or less, you have to think that when you start the first day of your period, after 10 days, we will do the first scan to see if your endometrium reach a perfect thickness. If it's the case, we just need to wait that the donor is ready. We create the embryos, so we fertilize in that case with sperm donor, and after 5 or 6 days, you will have your embryo transfer. The costs are, it varies between 5,000 and 9,000 euros, and then it depends about the program that you choose. It depends about the guarantee and how many blastocysts we guarantee to you. It's true. I have another question. I have a question about the donor selection and information about the donor. If your clinic specialist have chosen the donor lady, what details you can share about her with patient and when? We normally share 2 important things: the age and the blood group. We also ask to patient if they want the concordance of the blood group with the blood group of the donor. Okay, these are the 2 main information that we can share, and nothing more, because we cannot participate. You cannot, as patient, participate to the donor selection, and you have to know that this selection is under the responsibility of the medical team. The medical team will choose the donor according to the lady phenotype, to the color of the skin, color of the eyes, complexity, height and weight. And this is something very serious for us. Thank you. Thank you so much. Okay. Egg donation is always a topic that creates several questions, and is not that easy. But I think that through patience and with a good support, we can solve you all your doubts. Fibroids is also a patient ask how we deal with fibroids. This is something that the doctor needs to check. And the doctor needs to check if this has an impact of or can have an impact on the implantation. So in that case, we probably ask to remove fibroids. In other case, if there is no major risk, note. Remember that we do not ask. We ask some exams. Of course, in order to start the preparation, but as we do not ask a lot of things, because we need to investigate and we need to see any attempt is different. And if, for example, the first attempt fails, we need to understand why. So probably in case in the second attempt, we ask you more. And if there is a third attempt, we ask you more. We need to discuss your case also into clinical session. Our biologist and our physician have periodical meetings discussing difficult cases and put everything together, common points, in order to have this solution for you. Biometric scan on the donor lady. I mean, we do. I do not understand if I understood what a biometric scan is, but normally we have our donors. Our donors are our patient. They come to the clinic. They pass a lot of tests, genetical test, gynecological test, psychologist. We have their pictures, and we do, the matching with your picture, the phenotypical chart that we ask. We normally ask the patient the phenotypical chart, the phenotype chart, where the patient needs to put all their most important features, and then we do the match. And this is why we work, and we do this every week, and we do this, with very, very accuracy and in a very exhaustive meeting. If fibroids are removed, how long is the wait or healing before transfer? It depends. It depends about how many fibroids. It depends about where the fibroids are. Sometimes it can be a few months. Sometimes it's less. This is also a thing that a physician can help you. Biometric scan using a software based on 3D facial resemblance system backed by algorithms. This is not what we normally do. We normally do this with pictures and with putting together all the information of the phenotypical chart. And I explain it's something that we do and we take very seriously every week with our meetings. So normally we pass a lot of time with this in order to do the best donor selection for our patients. But some clinics do also the 3D facial resemblance system, not us. Thank you. Thank you too. Yes, we have. We have African donors. We have also Afro-American donors, but we have the chance also to be in Barcelona, and Barcelona is very multicultural city with a lot of nationality and a lot of ethnicity cohabitating this capital, this city. So we have a lot of donors, and we can have African donors as well for our African patients. You're welcome. Okay. We have 10 more minutes to dedicate to your questions. We really hope that you enjoy the explanation. Okay. Do you split the donor eggs between two patients, or it is for one patient? Okay. Normally, you have to think about what we explained before. We have different programs, okay? From 1 blastocyst until 5 blastocysts. Normally, we stimulate our donor in order not to have many embryos, many eggs, so that we can normally assign to one patient. But sometimes when there is a high response, we can split donors between different patients. And we normally discuss this with patient as well. Then I can see I do not understand the question, which is old donor. You probably do you mean, and do you refer to the maximum age of donor? As I tell before and I explained, the donor age is between 18 years old until maximum 35 years old. The average of our donor, more or less, is 25, 26 years old. If there are donors with more age, like 30, 31, it's true that they can also be fertility proven because they have their own children. Thank you. I remind you that we are in Barcelona, we are Reproclinic, we are always here to help you and assess you. We are our team of doctors that speak several languages. We have a team of 5 doctors, and we work with you with patient and medical assistant. And we are 4 great embryologists in our lab that can help you and can protect and select your material. I remember you that this event is recorded and is online into the YouTube channel of my IVF Answer and EFS. It's something that I probably do not mention, but it really is important. Of course, when you undergo to an egg donation, the treatment is important, but there are a lot of any other aspects that are important as well. So if you need like the help of holistic services such as acupuncture, or such as a fertility coach, or such as a psychologist, our clinic has a net of contacts of these holistic specialists that can help you, because it's something that we don't take in account, but also our state of mind has an impact, and needs to be taken in consideration. So this is important. So don't be afraid to ask if you need the support of a coach or a psychologist. It's so important to be supported and to be, taking in account this kind of other points. There is not just the treatment, it's 360 degrees of any other aspects that can be important in the preparation. DNA fragmentation test, if required, yes, we do. In our lab, we can do this test. Do you offer a sperm DNA fragmentation test? If it's required, this is another question. We do. Our lab can do this kind of test. We are fully equipped, so there is no problem. We just have to book the visit, and we organized. And normally, when a patient needs to do this kind of extra test, we program everything, and we do like we send the patient the planning of their day. So you come at the clinic, you meet the doctor, after you go to the lab, and you leave the sperm sample, and we do this kind of test. And so also it's the same with blood test. We have our amazing nurses here that can do any kind of blood test, and they can process the results here. So there is no major risk. Everything is here in the clinic. Okay. We have like 5 minutes more. If you do not have any major questions, do not worry. I repeat that we are available, that we have our email address, Reproclinic at reproclinic.com. And we are available to answer to your question, to organize first consultation, to speak with you. My colleagues are always available. So it will be a pleasure for us to help you. I would like to thank you once more, IVF, my IVF answer, and the EFS. I think that these kind of events are really important to spread awareness to our patients, and of course to the patient to tell that you're not alone. A lot of people need to struggle with fertility issues, and so we are here for you. Yes, you can contact. We can contact. Patient can contact us from our clinic site. Of course, there is a form that you can fill. Of course, you need to check also the protection data law. We always work with protection data law, and when we receive the request, we normally put a contact in contact with the phone call or with emails. There is Karen that tell me, thank you for great webinar. Thank you for all the information. It's a pleasure, girls. Don't feel yourself shy to ask at all. It's very important. And please, when you choose the clinic, remind these 3 points: good doctor, good lab, good embryologist, nurses, and of course a team of patient and medical assistant that can help you and assess you during all the procedure. Remember that for us it's very easy. When you get pregnant, everybody is happy, but if not, our major satisfaction is to know that your follow-up have been great and that we are able, even if it didn't work, to make you feel a patient and not a number. This is so important. So this for me is the most important thing. I will leave you in 3 minutes. Thank you so much, Joy. Thank you for this great presentation. For me, it is a pleasure. I hope that my English is not that great, but I hope to make it clear. It's great to have you. So many assistants. Thank you so much. Oh, thank you so much. They tell me that my English is perfect. Not the case, but thank you so much. My colleagues speak better than me, actually, so don't worry. If you feel comfortable with your language, English, for us, we have a lot of people here speaking English, a lot of patient assistants. Our doctors are great with English, so don't worry at all. This is it's the easiest part. That's great. Okay, so I guess that it's the time. We have 1 last minute. Thank you again for being here. It has been an honor for me to participate and remind that we also assess you in a holistic way. We have a fertility coach. We have our psychologist, acupuncture if it's required. We can organize acupuncture the day of the transfer, before and after. We do everything that make you feel comfortable. And thank you so much. So I will leave you right now. Thank you again. And please contact us. Last time, Reproclinic at reproclinic.com. We are here to answer to your question, to organize for consultation free of charge, online or here at the clinic. Thank you, guys. Bye. Good night.